I just want my teeth cleaned, or I want my 2 free cleanings a year. We hear these things every single day in our practice. I'm Dr. Lindsay Cash with Periodontal Studio, and your tooth tip today is what's the difference between a healthy mouth cleaning and a deep cleaning or a periodontal cleaning. Here's the difference. Healthy mouth cleanings, similar to what you're probably used to, is just cleaning above the gum tissue. This is performed on patients that have no signs of periodontal disease or gingivitis. So you have pink, healthy gum tissue. There's no signs of bone loss. There's no bleeding when we measure your bone and gum tissue heights, and that is for healthy patients. A deep cleaning or a periodontal therapy, non-surgical periodontal therapy at that, is when we go in and we remove calculus deposits from underneath your gum tissue. Calculus is the hard stuff that we use our instruments to scrape off your teeth. There's no amount of brushing and flossing you can do at home that removes calculus once it's adhered to your teeth. That's what our instruments are for. When the calculus builds up underneath your gum tissue, it irritates the bone until the bone physically starts to dissolve away from the teeth. When that bone loss is happening, you have active periodontal disease that needs to be treated. Typically, what happens is our hygienist and myself will go in, we numb your gum tissue up, and in many cases, we treat half the mouth at a time. We numb your tissue up, and then we can use our instruments to slightly go below the gum tissue to remove those calculus deposits so that the bone loss isn't continuing to progress. My personal preference is that if we split that into 2 appointments, that those appointments are done no further than 2 weeks apart, so we can ensure that your mouth is getting completely cleaned and the quote unquote dirty side doesn't have time to reinfect the clean side that's just been completed. It's important to me that you understand why we're diagnosing the type of cleaning that we're recommending for you. And that's why we never promise at our first appointment that anybody's going to get a cleaning. We have to have a thorough and accurate assessment of your gum tissue and periodontal health to determine what custom cleaning fits you. And that's your tooth tip for today.